Gentleman is recognized.
After what was a long day yesterday, it's great to see us coming together today and show we can still get the job done in a bipartisan fashion here in Congress on health care, energy, consumer protection, for jobs, for all Americans. And let this be a sign that, if we work together, there's nothing that this Congress can't achieve. I'd like to also thank both you, Mr. Chairman, and my fellow Floridian representative, Gus Bilirakis, for working with me in a bipartisan fashion to move the Territories Health Care Improvement Act forward for our fellow Americans in the territories. I'd like to thank Ranking Member Walden, Chairwoman Eshoo, and Ranking Member Burgess for their bipartisan support and collaborative efforts to have the Territory Health Care Improvement Act included in this amendment. When you think about all the members of this Congress from our territories, Representatives Plaskett, Gonzales-Colon, Sablan, Radowagon, San Nicolas, as well as supporters such as Congresswoman Velasquez and other co-sponsors. It's been a long journey for a lot of those representing our territories and those areas of the country that often have strong links. This legislation, in short, will right a long-time injustice to Americans in the territories, as well as save lives there. Unlike the states whose federal medical assistance percentage, FMAP, is determined by its per capita income, the territories receive a fixed amount of federal funds in the form of block grants. While the FMAP for states can go as high as 83% for states that need it, the territories' matching rate is fixed at 55%. Section 1108 of the Social Security Act further caps the amount territories are eligible to receive, thus restricting additional Medicaid funds the territories desperately need. This amendment would provide the territories with several years of increased federal funds. Puerto Rico's Medicaid allotment would be increased to approximately $3 billion per year for 4 years, which is huge. Allotments for the U.S. Virgin Islands, Guam, American Samoa, and the Commonwealth of Northern Mariana Islands would be increased substantially to prevent future federal funding shortfalls for the next 6 years. This legislation is needed because the Commonwealth of Northern Mariana Islands has exhausted its ACA funds as well as all other sources of federal and local funds for its Medicaid programs, and we've heard from Delegate Sablan about that. While Guam and American Samoa are unable to generate the non-federal share required to draw down federal funds, which we've heard from their members as well. Additionally, the USVI will exhaust its Medicaid funding in 2020. This amendment could increase the territory's Medicaid cap to alleviate these shortcomings. Following the devastation caused by Hurricane Maria, many specialists and residents fled Puerto Rico. This was due to specialists not being able to be reimbursed through Medicaid, leaving patients unable to receive the care they desperately needed. The lack of sufficient Medicaid coverage and statutory caps also contributed to Puerto Rico's debt issues. By not having FMAP, they actually contributed to the reimbursements of medical specialists and patient needs. Puerto Rico has been forced to spend more of their already strained budget to meet required Medicaid standards, thus leading to many medical specialists and Medicaid-eligible patients fleeing the island to states where they could receive coverage and access to quality care. My home state of Florida, New York, New Jersey are favorite destinations for Puerto Ricans fleeing the Medicaid shortfalls. By passing this legislation, we also help states by ensuring that the Medicaid systems that so many of our fellow citizens depend on are properly funded. However, following the news of corruption of officials in Puerto Rico, we know that merely funding the Medicaid systems in the territories is insufficient. We must also have stringent integrity measures to ensure the allocated funds reach our fellow citizens in need of medical assistance instead of lining the pockets of corrupt officials. I thank the Ranking Member, Walden, as well as my fellow Floridian Representative Bilirakis for their leadership in working with me and others on the committee for good governance amendments. This will ensure strong integrity measures are put in place to guarantee further corrupt actions of officials will not be tolerated moving forward. Thank you for all who participated in this amendment to safeguard the ability of fellow Americans in the territories to achieve the quality health care they are entitled to. Thank you again, Mr. Chairman. I yield back.
Thank you.